Hey guys, welcome back to The Purpose Nurse. If you have already been on my channel, but if this is your very first video, then welcome. So today I'm going to be sharing a video with you guys discussing what I take with me in my bag to clinicals. I know that depending upon what type of nursing program you're in, what you bring in your clinical bag may vary slightly, but for the most part, there are a couple of things that I feel like every nursing student will have in their bag with them when they go to clinical. So if you are interested in wondering what I put in my clinical bag, then keep on watching. Okay guys, so to start this off, this is my clinical bag. I'm not sure the material that it's made out of, but I'm going to link everything down below in the bio so that if any of you are interested in obtaining any of these items, you will have all the links to get them. So let's start. Our first thing. So these are big pens, and these pens are amazing. Instead of you carrying around like multiple pens, it's one pen, but it has 4 different colors on it. So this is pretty awesome, right? You don't have to carry around a bunch of pens with you and be a pen lady or a pen guy. But if you are, that's okay. The second thing I have in my bag is a nursing diagnosis book. So this is very, very important as a nursing student, because just as medical students have their medical diagnosis, nursing students have their nursing diagnoses. So I feel like carrying this with me allows me to look at some of the defining characteristics that my patients may have and help me formulate a nursing diagnosis and come up with an awesome NANDA for the patient. So this is my stethoscope case, and I believe I got this off of Amazon. It's just a gray basic case, and inside I have this cute little pocket drug guide. This is obviously great because you can look up the meds that your patient is on if you're not very knowledgeable about them. Depending upon the type of hospital that you work at, they may also have a medication database. So I know for UCLA they utilize Micromedics, so you are able to pull up Micromedics on the computer and look up the information about your medication. But if you don't want to do that, again, you can have this little pocket guide. I kind of use both. The Micromedics gives me a more expounded version of things, whereas obviously the pocket guide is going to be more direct, succinct, and give you the essential information that you need. Next thing I have is going to be a calculator, obviously for med calculations. That's very important. And then I have my handy dandy stethoscope. You definitely need this to listen to your heart sounds, your lung sounds, and anything else that needs to be auscultated. I also have my pen light. Now, I believe I got these off of Amazon too, and they also have the sizes of the pupils on there. I'm not sure if you guys can see that. Or let me turn around. Yeah. And then also I have this amazing clipboard I like this a lot because of the material, the plastic material. I'm able to wipe this down. So if I have to take it in a patient's room, I don't have a problem when I leave out the room to wipe it down. And it has the little opener on the side, clamp, whatever you want to call it. And then obviously you can put papers on here, clip part right here. And I also have just a little bottle of hand sanitizer right here. It's pretty much almost empty. And that's about it, you guys. I don't have any snacks or anything in my bag because our first round of medical surgical clinicals was only about like 6 hours, but if you count the time that we had to meet with our professors before our clinical day began, it's pretty much only like 4 hours. So I would normally just eat like a really big breakfast, and by the time our day ended, I would go get some lunch. But our quarter coming up for our medical surgical B clinicals, we will be doing 12-hour clinical shifts. So I definitely will be packing some snacks, some goodies in my clinical bag. But that's it. That's all I have to share with you guys. I hope this is helpful for any of you that are about to begin clinicals and are wondering, what should I put in my clinical bag? And I also feel like it should be helpful for any of you guys that are interested in pursuing a nursing career and just curious about what you would take with you when you get to the stage of starting clinicals. So thank you guys so much for watching, and be sure to like this video and subscribe to the Purpose Nurse channel. Bye.